Hi, there are multiple myths about epilepsy diagnosis and treatment, and today we'll talk about all those myths that are considered for epilepsy and tell you the truth about them and what is the right treatment and diagnosis for epilepsy. The first myth is swallowing the tongue during the epileptic seizure. Lots of people fear that that there is going to be a swallow of the tongue and death because of epilepsy and epileptic seizures. This is a myth. There is no physiological way or anatomical explanation or any proposed truth to this. There is no way that a patient with epilepsy can swallow their tongue. What happened is that the tongue is stuck to the mouth. It's not going to be swallowed. What happened is that during the epileptic seizure, there is a fire in the brain, and the brain will start dumping water, dumping GABA. Those will inhibit the brain electricity, so you will end up kind of like firefighters putting off the fire, so you will end up with a wet field, wet paper. You cannot write on it. The brain will be stunned for a while, and sometimes that will be so strong inhibition that the brain will not even be sending information to the lung and to the heart to breathe and circulate, and that can be dangerous, and people can die because of this very strong inhibition in the brain. What can you do about this? First, you cannot prevent tongue bite or anything in the mouth. So do not put anything in the patient's mouth during the epileptic seizure. You can turn them to the side so that if they throw up, or if there is any blood from the biting of the tongue, will come out of the mouth, and the seizure will stop and make them the environment safe, so there is nothing can hit them. And then the second thing you will do is to stimulate the patient, which will wake the patient, wake the brain up, so that it will send signals to the brain and the body and to the lungs to start breathing again. But do not put anything in their mouth. There is nothing called tongue swallow. The other myth is epilepsy can be treated by walking barefoot on the sand or making sujood or like putting your face to the ground. Those are myths for epilepsy, because epilepsy is an electricity problem inside the brain cells, and at the cellular level, it is not an electricity that you acquire from like rubbing your hands or some like wool or something like that. We see this a lot during the winter months. So this is called static electricity and has nothing to do with epilepsy. So walking barefoot or on the sand will not ground the electricity you have. Some people will think that wearing a metal or copper bracelets will cure the seizures, and that is also a myth. There is no recommendations or treatment for epilepsy that includes any bracelets that you can wear. But you can wear a metal bracelet or alarm bracelet that will tell the medical providers or anyone that you do have epilepsy, and it is highly recommended to do so. If you have any questions about epilepsy, you can write them in the comment, and I do go live multiple times, and I can answer all your questions during my live stream. So make sure you subscribe to the channel and hit the notification bell so that every time I go live, you'll be notified and I will answer all of your questions. And I am available for consultations. So if you want to consult with me directly and get medical advice and second opinion, you can do so by contacting my hospital, the Henry Ford Hospital, and you can get the consultation through that. And I will leave all the details in the description below. The other myth is that epilepsy is not treatable. So epilepsy is a chronic condition. Yes, it is an electricity problem in the brain, and it needs long-term treatment, and it is a chronic condition. But that does not mean if it's not curable, it's not treatable. Epilepsy can be treated, and we have very good advanced medications and surgical treatments and devices and ketogenic diet and other diet therapies. So we have so many options for epilepsy treatment. So do not lose hope. We're working on it very diligently, and on this channel, I will give you all the recent updates for epilepsy from the Epilepsy Encyclopedia. The other myth is that the association of epilepsy with mental illness or possession by souls or evil spirits or jinn or any of that. There is lots of people think that epilepsy is a possession by souls or jinn or any of that, but has been going on for thousands of years. Anything that humans could not understand or explain, they will put that into any higher powers of jinn or spirits or curse or anything. And there are lots of people try to treat them this way by healers and other things. So, but epilepsy now is understood as a neurological condition with electricity in the brain, and it is needed to be correctly diagnosed and treated for the patients to get better. Other myth is that cupping and hojama will treat epilepsy. Well, cupping therapy is used for pain conditions and muscle-related disorders, but it does not get approved for or recommended for treatment of epilepsy. Also, the Cleveland Clinic on their website recommended that we should avoid cupping and hojama in any patient with epilepsy history, and this treatment is not not approved and should not be given to patients with epilepsy. It does have complications of infection and other issues, so we should avoid doing cupping for patients with epilepsy. There are many right treatment for epilepsy that we can do but with good diagnosis and good treatment, and I'll explain all those advancements in treatment of epilepsy and how we make the diagnosis and do the right treatment in this video. And stay healthy and see you in the next one. Salam.